Hi everyone, my name is Dr. Kyle Schneider. I'm the owner and chiropractor at Riverstone Chiropractic and Wellness. I wanted to do a short video showing you a new piece of technology we've added in our office. It's called digital motion x-ray. How this is different than normal x-ray is digital motion x-ray takes a video of the spine in motion, so we're able to see what your spine looks like when you're moving in different directions, or if you have a painful movement, we can have you move in that direction and see what your spine looks like during that. So right here we have an image of the neck. This is the lateral version. In a second I'll hit the play button and you'll see this patient looking up and down for flexion extension. For the cervical spine, for the neck, we do 7 different movements. This puts stress on different segments of your spine and also different ligaments, so we can see if there's any ligament damage. We can also pick up different views to see if there's a hidden fracture. We also have the picture over here of the patient. This allows us for patient identification. We can see how they're moving. If they do have pain, we can pick that up as well, and also trace it right into their x-ray. So let me hit play here and you'll get to see the patient looking up and down. So what I'm looking for during these motions, see here, is I'm always looking at the alignment of the spine. Is it smooth? Is it following the right path? Next, we're having them look all the way up. Also checking for any restriction. Is one of the levels moving too much, too little? So this is all the way up. Next, I'm going to pause it when he's looking straight ahead. I'm going to trace a couple things out for you. Let's go back just a hair. Okay, right there. What I'm looking for normally is a smooth arc in the back of the spine. There's a normal curve here, so I'm going to trace the back of these vertebrae. You should be pretty smooth, all following the same line. I see a disruption there, pretty big disruption there, a tiny bit there. So we're seeing all these kinks and angles. There should normally be a smooth reverse C-shape or banana curve. As we see here, it's taken on almost an S-shaped configuration. This is very common in car accidents and motorcycle crashes like this patient had. When we see the slips in going forward or backwards, it's signs of anterior longitudinal and posterior longitudinal ligament damage, which is indicated right over here. So I'm going to erase these. I want to show you one other view of something else we picked up on a different range of motion. So 1 second here. I'm just scrolling through different angles. This is, I'll play the last ending of one view and then I'll show you the normal one. Okay, so this is a right oblique flexion extension. We're looking at the nerve holes on the side here. Here's the left side. This is where we picked up the injury. I'm going to put a circle on it and then I'll hit play and I'll show you. So for this one, we're looking at these nerve holes here, 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 here. What caught our eye is right on the back here. So this is actually a fracture here. You can see that white space there. This should be connected. It's a fracture in the posterior facet joint in this patient's spine. It's likely the reason why he's been having pain for so long. So I'm going to erase that. Also, we can see some stretching here. It's a sign of facet capsular stretching. But the main thing is that fracture in the back of the facet joint. So I'm going to play. Let you see it one more time. So right here, that's where the fracture is. And this allows us to find the injuries. That's the unique thing about digital motion x-ray, is that we have a specific protocol for each part of the body, put stress on different ligaments, and also get different angles so we can see if there is an injury. This is very good for car accidents, motorcycle accidents, sports injuries, or if you're having neck pain, back pain, extremity pain, and you've done all different kinds of tests and you're looking for the next step, you might be a candidate for DMX